There are new fears about a second wave of COVID-19 in South Africa, as we see the virus surging in various countries around the world, particularly in Europe and the United States. Here we've seen super spreading incidents in Cape Town and also now around Fort Hare University in the Eastern Cape. And then, of course, overnight, the news that one of the symbols, if you like, of our struggle against COVID-19, the Health Minister, Dr. William Mkhize, and his wife, Dr. May Mkhize, have both tested positive for COVID-19. To discuss this, we're joined now by the Professor of Vaccinology at Wits University, Professor Shabir Mahdi, and also Professor Mark Mendelsohn, the Professor of Infectious Diseases and head as well of the Division of Infectious Diseases and HIV Medicine at Groote Schuur Hospital at UCT. Professor Mahdi, if I may just start with you, good afternoon to you both. Firstly, does it look to you like we're about to see a big surge in the virus here, what people call a second wave?
So good afternoon, Stephen. So, Stephen, I think that there's going to be a resurgence of COVID-19 in South Africa. It's almost a given. The big question is the timing of when that resurgence might occur and what the magnitude of the resurgence would be. And I think we need to be careful about drawing any comparisons to what is currently happening in Europe in relation to what might occur in South Africa. So the European experience with the first wave of COVID-19 is actually quite different from the South African experience with the first wave of COVID-19. The reason why the epidemic waned in Europe was largely because of many of the European countries going into a lockdown at a time when the epidemic was peaking. And consequently, what happened is that after those lockdowns were lifted, there's only about 10% of the adult population in Europe that were infected. In fact, some European countries less than 10%. But the reason why there was a waning of the epidemic in Europe was largely because of the lockdown itself. In South Africa, on the other hand, what happened is that we went into a lockdown at the very early stage of the epidemic. And as the virus continued to surge in terms of number of cases, we became less restrictive in terms of what was happening in the country. We were going from level 5 to level 3. As an example, before we had even peaked in terms of the epidemic, we were allowing 100% occupancy of taxis. Inadvertently, what ended up happening in South Africa is that in the context of that sort of approach, we ended up having probably about 1/3, up to 40% of adults that have likely been infected, especially in the major urban metro areas. And these are data from the Western Cape and some limited data from Gauteng, which indicates a high percentage of people that have been infected. Now, that percentage of people being infected, coupled with the use of the non-pharmaceutical interventions, things such as face masks, avoiding overcrowded situations, as an example, actually lends itself to a waning of the epidemic because of a type of, I wouldn't call it herd immunity in the strictest sense, but where a sufficient percentage of the population has become infected, the virus is not transmitting that effectively because of the use of the non-pharmaceutical interventions, and that's the reason we ended up going downwards. So a very different reason to the European, a very different experience to the European experience in terms of why we went down.
It's a fascinating series of examples, and Professor Mendelsohn, what this tells us is that this is in a way all about timing. But once, well, we hope, we don't know for certain, once more and more people have had the virus, it should give us more protection. But let me stress, we don't know for certain, do we, Professor Mendelsohn?
We don't know for certain, but there's fairly good evidence that there's cross-protection from other coronaviruses. We have coronaviruses which cause common colds across the world, and one of the reasons perhaps that we're now in the position we're at is that not only was there high transmission within urban areas, as Shabir has said, but also that there was a level of cross-protective immunity. The actual timing of a second wave, and I agree totally with Professor Mahdi that you can't really compare what's happened in South Africa with what's happened in the global north. So the timing of this second wave and how bad it will be, and we don't think it'll be as bad, is difficult to predict. In the northern hemisphere, it's timed towards their autumn period. But again, as Professor Mahdi has laid out, the actual timings of the lockdown and the issues in those areas were very different to what we faced here.
Professor Mendelsohn, is there also a difference in what we know? And let me explain what I mean. In the United States and in Britain, where they're again having big arguments about lockdown and amazingly still around face masks, which is just incredible. They obviously now have a high rate of data. They know roughly how many people have the virus, and that's partly because they do more testing than we do. And yet here it seems that we seem to be in a better situation in terms of, even if you look at the number of excess deaths, for example, it does seem that we're in a better position than they are. And I remember Professor Salim Abdul Karim making the point that unless South Africa has a different mojo, was the word that he used, we're in for a very difficult time. You're talking that perhaps we do have some sort of mojo, to use that word, in the form of this cross-protection.
Yes, I mean, I think I'm not sure if I'd use the term mojo. I mean, the circulation of coronaviruses other than SARS-CoV-2, which causes COVID, in other words, the coronaviruses that caused common colds during respiratory seasons, we seem to have a fairly high number, and that's perhaps contributed to this cross-protection that we have. I think in terms of data, I mean, everywhere in the world, apart from very few countries, have a problem with the fact that we're not able to test enough, so we don't know the true number. We can only tell the number of cases that have been tested, and obviously, we know that the number of infections, the true number of infections in South Africa is vastly over the number of around 700,000 that we now have documented. So call it what you will, but that cross-protection has probably helped.
Professor Mahdi, we've also seen, and we saw that in our first wave, if we still call it that, of the virus, that there were different surges at different times. So the Western Cape surged first, then Gauteng, the Eastern Cape, KwaZulu-Natal. And that also then suggested that, in fact, the virus had been present in the Western Cape community before we actually realized. In other words, it's unlikely that what we call the first case, the case in Hilton in KZN, was actually the first case. What does that tell us about what a second wave would look like, the way the virus moved through South Africa the first time round?
So, Stephen, you might be correct that there might have been earlier introduction of the virus in the Western Cape, but I think the reason why the Western Cape peaked before the rest of the country probably is multifactorial. I don't think it's only about when the virus might have seeded. It's also about the amount of virus that might have been imported. There might be a climatic factor that might be contributing to why the Western Cape peaked before Gauteng. And this is an observation that we also have for other respiratory viruses. Many of these respiratory viruses, in terms of the annual epidemic, starts off in the Western Cape and then starts tracking elsewhere in the country. Now, in terms of what you expect with regard to a resurgence, again, extremely difficult to predict exactly whether the Western Cape will start off before other parts of the country. In fact, I just saw reports today, as an example, where there's concern that the Free State is already experiencing a resurgence. If you look at the Western Cape, and if you look at the Medical Research Council excess mortality data, there's again an uptick in terms of the number of COVID-19 deaths that have occurred, and that might have been almost already 2 weeks ago compared to when it had come down. So it's really difficult to predict exactly what might happen in different parts of the country. To a large extent, I think the main influencing factor as to how quick there would be a resurgence is dependent on the behavior of citizens again. It is about when people become complacent with regard to the use of the non-pharmaceutical interventions, when people start engaging in mass gatherings, not wearing face masks in public spaces. Those are the circumstances that are going to allow for a resurgence of the virus. So to some extent, it's going to depend on the behavior of citizens in different parts of the country.
And Professor, let me be specific, Professor Mahdi in this conversation, excuse me. What this also then brings to us, I mean, you talk to us about different situations in different parts of the country, but over the Christmas period, people go home, they go to Limpopo, they go to the Eastern Cape, they go to visit family in KwaZulu-Natal, they go to the beach, everyone goes to Cape Town, no one from Cape Town goes to Gauteng, but there's a lot more movement around the country. I mean, that presumably could have a big impact on all of this. It would scramble any prediction that we make in terms of how it would move through the provinces.
Yeah, without any question. And I think my estimate is that we're probably likely to experience a significant resurgence in terms of spread of the virus in the first quarter of next year, probably around about February or so, when people have returned from vacation, when people have returned from whatever type of mass gatherings they've been engaged in. And exactly for that reason, we might well see the Western Cape and KZN probably starting off a bit earlier than the rest of the country. But I think the type of conditions that you're alluding to is exactly, to some extent, what has led to the resurgence in many of the European countries, in that resurgence has started after people came back from the summer vacation period.
Professor Mendelsohn, I mean, what we also have is temperature. And I know there was this sort of idea that, you know, the virus would disappear from South Africa because summer was coming, and then it turned out that's not the case at all, from what I understand. Temperature is not that big a factor, but it does affect people's behavior. In other words, in winter you spend more time inside, in summer you spend more time outside. And Professor Mendelsohn, you're actually a lot safer from the virus. I mean, will that have an impact on how this virus moves during the forthcoming months?
Yes, I mean, as you say, there are multiple examples from other countries that are, you know, very warm, very hot all year round, where they had outbreaks in large numbers. So it's not so much, I mean, temperature, humidity. They're all are factors within spread in respiratory viruses. But the issue, as you're saying, in the summer months, we do spend more time outside. We are able to ventilate our indoor spaces often better. You know, we open windows more. We have more air changers that dilutes virus that are on aerosols, or, you know, when there's large droplets between people speaking. So, you know, I think there is a change in behaviour, and yes, that change in behaviour does play a role.
I'm going to put this question to you, Professor Mendelsohn, but I'd appreciate a view from you as well, Professor Mahdi. What else does government need to do? So at the moment, we're level 1 of the lockdown. Mass events are still banned, and I think will be for some time. Still regulation on the books that you must wear your face mask at the moment that you leave your home or as soon as you're with anyone. All of those things are important. By and large, I realise there's a bit of complacency creeping in. By and large, those regulations are on the books. Anything else that government needs to consider doing at this stage, apart from maybe preparing hospitals?
Well, I think that there definitely needs to be a very strict focus on understanding what the lessons that were learnt from this last 8 months or so, what we got right in national policy and provincial policy, what we got wrong, and ensuring, therefore, that, you know, there's a very clear plan going forward in any eventuality of whatever a second wave might look like. But, you know, again, Shabir was 100% correct. You know, this is a social contract, and the citizens of South Africa have got to put complacency aside and understand that this virus is still very much with us. You know, I did a ward round this morning on our wards with COVID patients. You know, if you're on the front line, it's very real. This has not gone away. And therefore, you know, until vaccines come, you know, it's all about the non-pharmaceutical interventions, the social distancing, the masking, ventilation, hand hygiene, etc. And government really needs to persist in positive communications around this, because that's the key.
Professor Mahdi, would you agree?
I fully agree with Mark. It's all about citizen behavior. The last thing we should do, and the last thing government should do, is consider going into a higher level of lockdown. That is not going to achieve anything. In fact, in terms of viral transmission, in terms of the rate of infection, the number of people that got infected, the lockdown itself didn't achieve much. It assisted us in terms of that, allowing time to prepare our facilities, but beyond that, considering that up to 1/3 of people might have been infected, that didn't achieve containment in terms of the spread of the virus. And it's all about the public messaging around the importance of adherence to these non-pharmaceutical interventions that Mark alluded to.
Professor, I really do appreciate the time. Professor Shabir Mahdi is the Professor of Vaccinology at Wits University. Professor Mark Mendelsohn is the Professor of Infectious Diseases and Head of the Division of Infectious Diseases and HIV Medicine at Groote Schuur Hospital and the University of Cape Town.